Hello friend, welcome to this new session. In this session, we are going to discuss the questions of Inicet MDS November 2022. The clinical subject are forming the major chunk of your exam. The prosthodontics part, your pediatric dentistry and public health dentistry form the major dental component of your exam. And in this video, we are going to discuss the questions from pediatric dentistry. So the first question that was asked from your pedo session is what is the ICDS scoring given to this tooth? So you know that from the past few years the ICDS score is the favorite question of the AIMS faculty these days, and they are asking ICDS scoring in a different way. So let's discuss this ICDS score. This is given for the caries, and there has been it has been put forward first in 2001 and again in 2009 when the root caries were also given scorings. So the scoring ranges from 0 to 6, and code 1 and 2 are given score of initial, code 3 and 4 were called moderate caries, and code 5 and code 6 are called extensive caries. So the code 0 is given to the tooth which shows no visible sign even after a 5-second air dry. Okay, if you can see clearly, I don't know if you can see clearly the images or not, but I tried my best because I do not find very clear images for this particular. So let's excuse me for this only. So for the code 1, the first visible sign of caries, that is enamel opacity, is seen on air dry. Okay, and it is confined to the area of pit. For the code 2, the carious sign is present in presence of moisture and it is not confined to your pit. For the code 3, the enamel is involved but there is no dentine is visible. Okay, for the code 4, the dark shadow of underlying dentin is visible. You can see clearly in this image the dark shadow, that is blue hue of your dentin is visible. Okay, this is your code 4. For the code 6, the clear cut dentinal cavity is there, and less than half of your tooth surface is involved. For the code 6, extensive distinct cavity with dentine involvement is there. Cavity is deep and wide, involving more than half of your tooth structure. Okay, this image can be seen very clearly from where your image has been asked. You can see in code 5 that a clear cut dentine is involved but less than half of your tooth structure is involved. For the code 6, you can see in this image that your more than half of your tooth structure is involved. Okay, so for the question it is code 5. Okay, now let's discuss second question. That is very straightforward question, and the question asks about which of the following is not used for pulpotomy. So answer is very straightforward. Question is also very straightforward. That is maestro paste, because maestro paste is used for your obturation on the deciduous tooth. And maestro paste contains zinc oxide, iodoform, thymol, parachlorophenol and ionolin for the constituent. Okay, this is used for the obturation in the primary tooth, and you can also use for obturation in primary tooth, that is zinc oxide eugenol, KRI paste, Volkov, Endoflas, Vitapex or Metapex. These are the options for the obturation in your primary teeth. For the former cresol and your glutaraldehyde, ferric chloride are the options for your pulpotomy. Glutaraldehyde has to be applied only for 3 to 4 minutes for your pulpotomy. Okay, now let's discuss the next question. Question that was asked is which of the following and in following and in class 2 molar relationship: A of mesial step, B flush, C distal, and the combination of options are there and you have to choose the most appropriate combination. Okay, so let's discuss which of the following terminal and in class 2 molar relationship. So first see flush. So this is your flush terminal in which the distal surface of your E of maxilla coincide with the distal surface of your E of mandible. Okay, so this is your flush terminal and in your early first transitions period, your molar and incisor erupts, and it involves the early mesial shift by utilizing your primate space. So what are your primate space? So the primate space are those spaces in the maxilla which is it is mesial to canine, and in the mandibular it is distal to your canine. Okay, so as you can see, if you're in the first transition space, what your molar erupts, that is your 6 is erupting. So you can see the 6 is erupting and put some force on your adjacent tooth. So it puts your 6 put some forces on the molar to move mesially, that is your first mesial shift, and utilize this primate space. As you can see, this amount of space, this amount of distance has to be moved uh, by the tooth to fill up this primate space. Okay, that is 2 tooth are there and you have to fill this primate space. And for the maxilla there are 3 teeth are there to 3 teeth segments have to be moved to fill this primate space. Okay, so it move early. Okay, it move early and fill up the space. Sorry, no, you can't see. So now just delete it. So this is your molar flush terminal, and when it forces are applied, it ends up into your end-on relationship. Okay, but when some extra forces is applied, so this mandible puts some extra force, so this move and more anteriorly. जब वो more your mandible moves more anteriorly. Okay, so your this is your maxillary E, and this is your mandibular E. Okay, this is your mandibular E. So now it goes into your class 1 relationship. You exactly remember the class 1 relationship, when the mesiobuccal cusp of maxilla falls into the buccal groove, and this is your class 1 relationship. Okay, so with the growth of mandible and in the second transitional space, the space incisal liability is there, and there also been a space of leeway, space of Nance, that is extra space which is utilized. So this so you can safely say that for the flush terminal it ends up into your the flush terminal ends up into end on, फर्स्ट एंड्स ऑन, उसके बाद वो क्लास 1 में चला गया. ठीक है, फ्लश टर्मिनल आपको क्लियर हो गया. नाउ गोज फॉर योर डिस्टल स्टेप. सो आपके डिस्टल स्टेप क्या था कि ये है आपका डिस्टल स्टेप. यू कैन सी दिस इज़ योर डिस्टल स्टेप. This is your distal step. Sorry, I have to make it again. So this is your tooth, that is your E in your deciduous dentition. Sorry, I have been habit of making flush terminal. So this is your E of maxilla, and the terminal is your distal. So this is your distal terminal. How can I say it is a distal terminal? Because you can, if the patient, I just learned in a simple way, if it is to the distal side or it is a mesial side, you can see that there is a distal step. That means if I make some person, like a person is standing on a stair, and this is your distal side on into which a patient can stand. If it is your mesial step, that is, it is your mesial side, it is your distal side. So on this mesial side a person can stand. This is how I learned which one is mesial step and which one was distal step. Okay, so you can see this is a distal terminal. So this is mesial side, this is mesial. So this is your distal. So by where is there? Yeah, So the for your first distal step, as you can see clearly in the image, this is mesiobuccal cusp. Normally the mesiobuccal, you can clearly see that the distobuccal cusp is falling into buccal groove. So it is class 2 relationship. This ends in class 2. अगर आपका 6 आया और 6 और 7 आया और it push the E in a mesial direction, so it falls into and-on. Okay, so this become your and-on relationship. Now let's understand the mesial step. Okay, so this is your mesial step. Okay, this is your mesial step. ठीक है, ये mesial साइड था, ये distal साइड था, और आपका अब ये mesial स्टेप बन गया. क्यों बना? बिकॉज ऑन दिस अ पर्सन कैन स्टैंड. ठीक है, अब बात करते हैं mesial स्टेप की. तो mesial स्टेप में क्या हो रहा है? mesiobuccal cusp in buccal groove. सो ये क्लास 1 बनेगा. यूटिलाइजिंग दोज योर leeway space of Nance, your early mesial shift utilizing your primate space and the mandibular growth. So mesial shift, prominently the mesial shift, that is early, and second mesial shift. And you guys know that early mesial shift is due to primate space, a late mesial shift is due to utilize your leeway space of Nance. So basically the mesial shift and cause the mesial terminal in class 3. Okay, this put some your 6 and 7 put some pressure on this mandibular tooth, and it moves more anteriorly and ends the tooth in a class 3 relationship. Okay, now the next question that was asked, which is very straightforward in your exam, the most common tooth affected by the early childhood caries. So your early childhood caries, that is also called maternally derived Streptococcus mutant disease. So it got two type of variety, rampant and nursing bottle. So rampant is very fast spreading, and so mostly earlier childhood caries is that caries which involve the tooth in a very faster pace, and it involves the tooth which are most immune to caries, that never which we find very rare to have affected by caries. That is your maxillary incisor. Why maxillary incisor? Because it is your maxillary incisor. It is your only and only maxillary incisor which is affected by your early childhood caries, because your mandibular incisor are in protection of your buffering of your salivary gland, plus your salivary gland is there which buffer it, plus there has been protection by your tongue which protect your mandibular incisor from the caries, and your maxillary incisor are less prone to caries, and this which are immune to caries are affected most commonly in your early childhood caries. Okay, now the next question that was asked in your exam was which of the following causes staining of gingiva and the tooth? You guys, it is very easy question, because the staining of gingiva and tooth is only and only by your silver diamine fluoride. You don't have to see the option for that. This is a very straightforward question. And the next question is also on the silver diamine fluoride. This question asks which of the following is a smart material. So it is silver diamine fluoride, because in a smart technique, that is silver modified ART technique, because आप में first SDF is applied followed by GIC restoration is applied. So this is a smart material, and it is also a straightforward question. You don't have to utilize your brain for answering this question. Next question is your percentage of silver in silver diamine fluoride. So silver diamine fluoride, these are the 25% silver is there, 8% ammonia, 5% fluoride. So the option, the correct option is 22 to 26%. Okay, that is option 2. So we utilize 38% silver diamine fluoride with 44,800 ppm fluoride. Okay, and next question that was asked, that is bleeding from socket after extraction of tooth is called post extraction bleed if patient reports after. This is a cramming kind of question, and answer for this is 12 hours. Okay, only then you can call a bleeding from socket is post extraction bleed. The next question that was asked on Jean Piaget theory, and the theory that Jean Piaget gave, it is a cognitive theory, that is cognitive development theory, and he was also the father of modern psychology. And cognitive means understanding. So the stages he gave was the sensory motor theory, in which there is object permanence is there, and it is from 0 to 2 years, that is toddler stages sensory motor. उसके बाद आपका आता है प्री ऑपरेशनल स्टेजिंग, which got two parts, that is pre-conceptual and intuitive phase. So pre-operational ranges from 2 to 7 years, which is your answer, that is option 1. Okay, next stage come is the concrete operational, in which the child focus on more than one attribute. You know, when we ask a child, when we in front of a child, we transfer our liquid from one bottle of slender to a squarish bottle. So the child do not understand that the same amount of liquid is transferred from a long cylinder to a squarish bottle. He's say the container that is cylinder has the long is very long and narrow, so the more amount of water is in that it is this feature is this feature is present in pre-operational stage. But when the child is more than 7 years, he or she enters into stage of concrete operational. Now he and she can differentiate this volume of cylinder is equal to the volume of your square, because the same amount of water is transferred from one container to another. Okay, this is your concrete operational. और उसके बाद आपकी फॉर्मल ऑपरेशनल स्टेजिंग होती है, जिसमें the child is puberty stricken and he or she believe that I am the one, he or she believes that I am the unique one, nobody can be like me, and there he or she imagines the imaginary audience, and he or she is in story of fairy tales, perfectionist stories. So this is all about your Jean Piaget theory of cognitive understanding. Next question that was asked was best source of stem cell from the deciduous tooth, and there is a image that was also asked for this question. I do not recall that image that was asked to you, but the stupid options are there, I suppose, because your bone morphogenic protein growth factors were there in the option. Only option of stem cell was the stem cell from the human exfoliated deciduous tooth. This is the only stem cell that is in the option. No other stem cell is in your option, so this is the best answer. And next question that was asked to you on Nola's staging, and I did not get what is the image, radiographic image was asked to you in your exam, but this is the radiographic imaging for Nola's, and the question was asked on the radiographic image and tooth jump, and they ask you to identify the Nola staging. So it was also a direct pick question, so I have given you all the Nola staging appearances in radiograph, and you know which is the which stage. So let's understand which is the Nola staging. It ranges from 0 to 10. For 0 there is absence of crypt, you can see there is no crypt formation, and in the 1 there is a presence of bony crypt. Okay, and for stage 2 there is initial calcification is there. You can see in your image 2 there is an image of initial calcification. And for stage 3 there is 1/3 of your crown completion is there, and you can see the 1/3 of the crown is completed in the third image. And for the stage 4 you can see the 2/3 of the crown is completed, and in the fourth stage there's 2/3 of the crown completion is there. And for the stage 5 whole of almost crown completion is there. You can see the almost amount of crown completion is up, not complete but is about to complete. And for the sixth, crown completion is complete. For the seventh, one third of the root formation is there. Sorry, crown completion, for the seventh, one third of the root formation is complete. And for the eighth, two third of the root formation is complete. While the ninth, root formation is about to complete, that is with open apex is there. For 9, open apex. For 10, root apex is closed and root formation is complete. So this is all about your Knollars staging. Next question they asked you is the order of fixation in the pulpotomy. This is very direct forward question, that is fibrosis, atrophy, inflammation and vital pulp. Direct pick question, no understanding, nothing has to be applied. Next question they ask you is the dental groove. Direct question. This dental groove, option 4 is the answer, that it starts from the incisive papilla, extend to the gingival groove in the canine and go laterally in the molar region. Now let's understand the other option. The one that separates the gum palate from gum pads from the palate is your gingival groove. That separates from gum from the floor of mouth, it is also gingival groove. That separates the future deciduous tooth, these are the transverse groove. So dental groove is only your option 4. Now the question that is clinical based. A 9-year-old kid is there with 2 1 is unerupted. Your 2 1 is unerupted, crowding in the interiors with 1 1 is fractured 2-month back, which is erupted normally at your 6.5 years of age. What should be the treatment? Okay, so there is a 1 1 fracture but it erupted normally at 6.5 of years of age, that is and your 2 1 is not erupted yet and there is a crowding. So what should be the treatment? You can see that 6 normally is at 6 years of age your 2 1 has to be erupted, but it is more than 3 years, the your 2 1 has not erupted yet. So that means something is there, some hindrance is there which do not allow your 2 1 to erupt, and there is a crowding. So that means you have to take radiograph to rule out any kind of hindrance, and in anteriors mostly the hindrance is due to mesiodens. Okay, so this is the perfect answer. So no wait and watch, which most of student thinks. So the answer should be radiograph to rule out the mesiodens, because 3 years has been passed and there is a crowding, plus you have to think that there may be some hindrance in the eruption pathway. Okay, so while doing cavity preparation of the deciduous molar, patient has a sharp pain which subside in few seconds. What should a dentist do? So it means that you have exposed the pulse, that's why patient reported with sharp pain. So you obviously have to inform the parent about pulp exposure and do the pulpotomy, not the pulpectomy, because pulpectomy is done when more than 72 hours of exposure is there or when there is a radicular inflammation, and this is your iatrogenic mistake, iatrogenic error. So you have to go for pulpotomy. Okay, now there is a question in your exam on desensitization. So this was I don't remember exactly this is the question or something else, but desensitization is a thing of non-pharmacologic behavior management, in which fear evoking stimuli is given, and at the same time a relaxation is also induced, so your anxiety reduces. So the substitution of a relaxation response for an anxiety response when one is exposed to hierarchy of feared stimuli. In this way, patient is not fearful of that stimuli which is earlier evoking anxiety. Okay, now the question was on molar incisor hypomineralization, and the most reason was asked for the failure of restoration, that is your irregular enamel structure. So which cause because the enamel is not mineralized properly, so your restoration is falling regularly. This is the reason for your restoration to fail. In the molar incisor hypomineralization, this was a question that was asked in your exam. And another was the identifying the space that was asked in your exam was the space maintain identification. So and the options were reverse band and loop and band and loop. So you have to choose which is the appropriate one. It is not the reverse band and loop, because reverse band and loop direction is opposite to the normal band and loop. As you can see in this image, this band and loop, the band is on your E, and the space which on which loop is there is a space for your E. So your normal band and loop runs in a direction from D, I mean from your distal side to mesial side. So it's a normal band and loop, not the reverse band and loop. And the buccolingual dimension of your loop is equal to the buccolingual dimension of the tooth that is going to be erupt in this space, and normally it is 8 mm. Okay, now the next question that was asked in your exam was difference between the primary and permanent dentition. Except slender root of the primary, yes, it is the roots of primary teeth are slender. Enamel thickness in primary is less than permanent, exactly. The accessory roots in apical area, accessory canals are in apical area in primary, which is very wrong, because in primary the accessory canals are in the furcation area. That's why your any of the pulpal infection spread very fastly and may involve your permanent tooth buds. Okay, the next question that was asked, the loop width in the space maintainer, which is 8 mm, which is very direct forward. And in this, which is very favorite question of all of your competitive exam, the age identification by seeing this kind of image. So as you can see in this image, your permanent incisor has not erupted yet. That means child has an age of less than 6 years, but the calcification of your molar 1 is there and molar 2 has been completed, and the crown formation of your incisor, permanent incisor, is complete. So that's why the age of the child is 5 years, because at 6 years of age your permanent incisor has to erupt. So it is not 6 years, but it is more than 3 years, because your calcification of molar has been completed. Okay, calcification of molar 1 and molar 2 has been completed. That's why it is more than 3 years but less than 6 years. Of the radiograph, that is which type of thing is present in this radiograph, what kind of anomaly you see in this kind of radiograph. You have to identify the radiograph. So you can clearly see there has been concavity on the external surface of the tooth, hence it is a case of external resorption. So in case of internal resorption, the concavity radiolucency is present in the area of pulpal region, and if it is a case of condensing osteitis, there is a radio opacity at the apex of the root. You see a condensing radio opacity, is the condensing osteitis show the radio opacity at the apex. Okay, two more questions are also there on fluoride, and one was image based question, another was a match the following type of question. And in match of the following question, they ask you the concentration of your fluoride, ppm of the fluoride, and the question was on molar technique, Knudsen technique, and they ask you what was the percentage, what was the agent, and you have to match the following. So I did not get exactly what were the option. And second question was also on the fluoride, but they give you the image and you have to identify which image is sodium fluoride, which image is for varnish, which image is for your APF gel. So I did not get my hands on those images, what were the actual image that were asked in your exam. So please excuse me for those two questions in the pedo section. And this is all questions that were asked in your pediatric section. Mostly every single question is expected and molar incisor hypoplasia is there. Your pharmacology or non-pharmacologic behavior management questions are there, and obviously these scenario based questions from the pediatric section in your Inicet MDS exam. And this is all for your MDS pedo recall. Okay, thank you guys.